Welcome back, and now our second segment is of equal importance as the first one. We earlier talked about that we're going to be shedding some light on the International Day of Gynecological Awareness and how important is it to women and everyone who could be interested in that matter, because you better get a glimpse about facts before they happen. To shed more light on this issue, we're very delighted to have with us Dr. Hassan, lecturer of gynecology, Cairo University. Good morning, Dr. Hassan.
Good morning.
A very good morning to you, sir. Would you please forgive my ignorance? It was for me the first time to know that there is a day for spreading awareness about gynecology and obstetrics. Would you please tell me first about the history of this day and why it's on the 5th of September?
Okay. It's about cancer vulval survival.
Mm-hmm.
One patient, after she survived from cancer vulva, she worked hardly in order to raise awareness about every item related to gynecology, starting from oncology to other disease. Our problem here in Egypt is that we didn't have any information about health education. Health education and health awareness is only exclusive to doctors. While you may not encounter any information about health education in your nursery, in your school, in your university. So we want to raise awareness more about health education, conditions related to gynecology. Most important of them is cancer, which malignancy. Most important is breast cancer, followed by endometrial cancer, cervical, ovarian, and last one, vulval and vaginal cancer.
Tell us about that particular day, and what exactly do you provide for the people who attended, those who are not doctors? How do you tend to provide or spread awareness among patients for more awareness in the future, non-patients? What exactly do you do?
Awareness about every item in gynecology.
Maybe I mean, in other words, what should every woman know or be aware of concerning that kind of
First of all, every woman should know her body. But if you look in your curriculums, in our schools and nursery, you finish your school, university, you didn't know anything about your body, your physiology. So maybe small informations, you didn't even know anything about it, how your body works, what is menstrual cycle. So this makes many problems for females. Even when you get pregnant, you didn't know how to get care of yourself. Many problems here in Egypt become more prevalent because of most people, big percentage of them are illiterate or poor, so they don't have accessibility to go to doctors or hospitals. But if we have health awareness and health education, they can protect themselves from disease. If we know risk factors of disease, we can prevent them. We can start like something like breast cancer. Many females don't know what is risk factors. Something like obesity, which is common here in Egypt, maybe family history.
Yeah.
Sometimes you get women who has breast cancer. When you asked her, did you have family history? She told you, yes, my mom has breast cancer. But why you didn't come before to tell your doctor? Every woman should know her family history. If she knows that one of her family parents has cancer and she goes to the doctor, maybe he can tell her something to do to prevent cancer, also to do early detection of cancer. What is important in cancer, not to treat it, but to do an early detection. If you detect it in early stage, the treatment will differ from detection in late cases. Maybe you have only to remove the breast cancer, but if you detect it in late cases, we may have to remove both breast.
If you want to comment on the video, sir.
Yes, this video is about cancer and breast cancer. What is cancer? It means that cells divides and grows rapidly. Then cells start to spread to other body parts through lymphatics or through blood. So if we detect cancer in early stage, it will not spread to other...
it's not going to move, the tumor is not going to move from the primary to the secondary areas.
It will stay in its place and its treatment will be easily. But if we detect it in late stage, treatment may be difficult. Sometimes the case is inoperable. We tell her we didn't know, we didn't have any treatment for you, just we give her pain, we relieve pain relief, yes.
Painkillers, yeah.
And so the videos shows about breast cancer detection. Here for doctor will tell her about something called breast self-examination.
Yep.
This information is not present here. We should tell every girl after age of 20 that she has to do breast self-examination.
Yes, sir. And this is the breast self-examination, and this was exactly to be added,
Yeah.
or to be added to the awareness
Yes.
campaign we should launch here. It's not about the after marriage period. It's about before
Yes,
marriage.
after age of
it's about
20.
the age of 20. Whenever
Yeah.
you are married, I know, because unfortunately there are many people who want to go to the doctors only when they are married, but before
Yes.
marriage, no. And this is, for, I mean, in my opinion, a catastrophe, a
Yes.
disaster.
Here in our culture, the women should go to gynecologist after her marriage. While if you think many problems can arise while she's still virgin, a girl. I remember that one girl about age 20 years, after she married, she didn't conceive. Then we do for her hysterosalpingogram to detect that fallopian tubes are okay or blocked. We detect that both fallopian tubes are blocked. When I asked her, she told me that she has, while she was a child, she has repeated vaginal infection, but she get ashamed to tell her mother. Repeated vaginal infection moved from vagina to cervix to uterus, then blocked both tubes. So if this girl has her curriculum in school, that there is something called vaginal infection, if you have any bad odor or sensation of itching, you have to go to doctor. We may save her fallopian tubes. This is an example for importance of health awareness. Many problems may encounter us in young age, and when we pass them, it will lead to complications later if we didn't detect and treat them.
Yep.
Right, doctor, there are a must-know points and signs when it comes to awareness. People who probably haven't attended that conference, if you could kindly elaborate those important points of awareness that every woman should know. You talked about the signs like bad odor and some infection and irritation and all those signs. There are also some significant signs for other serious sickness. If you can have spare us some of your time to just elaborate on those signs for awareness, just the general ones.
Okay. First one, we have said before, know your family history. If you know that your mom or dad has diabetes, hypertension, or cardiac disease, or has suffered before from any
Most
type.
friends of the Egyptian family now.
Yes. Unfortunately, maybe it is related to stress, to pollution, to bad lifestyle we are living now. So first of all, know your family history. If there is any bad sign in your family history, you should tell your doctor. Because if you tell him that you have a family history related to breast cancer, he told you that you have to do something called to mammogram or may do genetic
but I
study.
need to know the signs. What signs? I mean, if someone has like cancer in the ovaries, over the ovaries, and I mean other signs that would show that she really has to go to the doctor.
First of all, maybe
need to know the
abnormal
signs.
vaginal bleeding. Every woman has its menstrual cycle. So if she has any change in its cycle, maybe increase in cycle or it becomes irregular, she has to check her gynecologist. When she do ultrasound, when you do ultrasound, you check uterus, tubes, ovaries, cervix.
All the system.
All gynecologic system. Second, if you feel any pain, also you have to check your doctor. If you feel abnormal swelling, lump, maybe in your breast. So this is important to do breast self-examination. We tell every woman after age of 20, after your cycle, stand in front of mirror, do your breast self-examination for both breast. If you feel any swelling, any pain, any discharge
What about
from
the uterus area? Because
uterus.
this is the vague, part of information according that most of the women are completely ignorant about.
What's nice about uterus, that it's easily to detect any abnormality because it will lead to bleeding. Other sites, malignancy like an ovary, it's silent killer because it's present inside the abdomen. And for what I say now about ovary, its symptoms and signs vague, like
And can be easily misdiagnosed.
yes, misdiagnosed with internal
Easily.
medicine. She will not go to gynecologist because she will feel abdominal pain, bloating, change in bowel habits. So everyone tells her maybe you have to go to internal medicine doctor.
Or to something
What does that signify?
Maybe related to ovarian cancer. Sometimes because you know, an ovary is in our abdomen. So if there is malignancy on ovary, it can give symptoms and signs mimic to other abdominal disease.
Yes.
So this may lead to delay diagnosis. While endometrial carcinoma or cancer of uterus is easily
Of the
detected.
uterine wall.
Yes,
Yeah.
uterine wall. Uterus is made of body and cervix.
Yep.
So what you're talking about is the body. It leads to bleeding, which is easily detected. Why? Most commonly, endometrial carcinoma or cancer of the uterus will get in old age, so maybe above 60. So it's not normal in that age to have bleeding. So any case of post-menopausal bleeding, this means bleeding after menopause.
So the
is-
regular check, sir, whenever it's twice per year, for instance, would it be beneficial for all women?
Yes. After age of 40, we have to do annual checkup. First of all, I tell you, since you know your credit card number, you should also know your number. The number of blood pressure, number of your glucose, number of your weight, of cholesterol. If you know your blood pressure, glucose, weight, cholesterol, you will protect yourself from heart disease.
And for me, T3, T4, TSH.
Well,
T3, T4, TSH, the
yes,
thyroid.
very important also, because in old age, maybe we have changes in our thyroid metabolism. Many people don't know that the first killer of women is what? Not breast cancer, it's heart disease. Heart disease in old age women is the first killer. And the risk factors for this heart disease is hypertension, diabetes, obesity, high cholesterol, smoking, physical inactivity.
Yeah.
And here in Egypt, these all risk factors becomes prevalent. In old age, female become obese. She didn't measure her blood pressure and her blood glucose. Smoking becomes so prevalent here also in Egyptian females. So if we change these risk factors, we will protect ourselves from the first killer for women, which is heart disease. This is the first killer. Second killer for women is breast cancer. And breast cancer can be easily diagnosed by breast self-examination.
And mammography.
And after age of 40, we have to do mammography. When we do mammography, we can detect any breast lumps, even it is so
Tiny.
small. And this, as we said before, can change the diagnosis and can make the treatment easier. Breast cancer risk factors may be related to obesity, delayed menopause, smoking, women who hasn't get pregnant before or hasn't lactated before. So pregnancy
And breast augmentation, sir?
breast augmentation will not affect, but pregnancy and lactation protects women from breast cancer. So we encourage females to lactate, and also pregnancy in early age will prevent breast cancer. So risk factors, if
Would
we
you please define early?
early before 35.
Great.
Yeah.
Because this early may be unfortunately interpreted as early 16 or 17.
Yeah.
No,
This
it's
problem.
before 35, meaning in the decade from 20 to 30, and that's it.
Yes.
Yeah.
I'm lecturer and consultant of obstetrics and gynecology in Cairo University, Qasr Al-Aini. In casualty department, I remember before that I saw one woman, she was pregnant in her 5th child. When I asked her about her age, she told me, doctor, I don't know, you can check my ID. When I look in her ID, I was amazed that she was 20 years old and she was pregnant in her 5th child. But when I looked in her face, she looks like 40. This means that multiple pregnancy leads to exhaust women, drains women, and this still is common here in Egypt. Early age of marriage means that you will get pregnant in 1 and 2 and 3 and 4 child without repeated unspaced
When she
pregnancy.
was herself a child.
Yes, she's still child. She couldn't care of her child when she delivered him. Also, this repeated unspaced pregnancy drain her. At age of 30, she will look like 40 or 50, and mostly her husband will move to another woman and marry another woman.
Right. If the uterus cancer is genetic in the family, should it be a must that the one, I mean, the daughter would have cancer as well?
No. But this means that she has to tell her doctor, because her doctor will do her annual transvaginal ultrasonography. Ultrasonography is waves which will enlighten the uterus and ovaries. If doctor do an ultrasound and checks that endometrium is okay and uterus is okay, then this woman is
annual
okay.
checkup at least, spreading awareness.
Yes.
And I think those would be the key words which we're going to end this interview with, as we're running out of time, unfortunately. Dr. Amr Hassan, Lecturer of Obstetrics and Gynecology, Cairo University, thank you very much for being with us.
Thank you.
And have a very good day, sir.
Thank you.
Dina, it's time to go.
Right, and I guess this brings us to the end of this edition of The Breakfast Show. I'm Dina Hassan. I had all the pleasure to have with me Nermeen Abdurrahman in my
have
company.
a very good day, Dina.
Same here, and we'll see you tomorrow. Bye-bye.
It's goodbye. Bye.